Hello, I am KANG from Ina University College of Medicine. I will present about practical application of genomic approaches in advanced prostate cancer. This is what we are going to discuss today. First of all, I will briefly explain the current status of genomic approach and introduce the progress of the genomic approach in prostate cancer, including gene alteration, potentially actionable pathway and treatment, and the status of biomarkers related to diagnosis. And finally, a conclusion and future promises. Genomic profiling has grown rapidly and has brought about a paradigm shift in cancer diagnosis and treatment clinically. In particular, in case of non-small cell lung cancer, breast cancer, and colorectal cancer, many drugs and diagnostic methods related to the genomic approach are actually used clinically. But what about prostate cancer? It is true that it lags behind other cancers, but it is a blue ocean with many possibilities. Most of the studies have been conducted in the West, and there are few studies on Asians and few clinically applied data, so the limitations are clear. In particular, in the case of advanced prostate cancer, existing treatments often have limitations, so the development of genomic profiling and its clinical application will be very important for these patients. To date, the clinical application of the genomic approach and its future in advanced prostate cancer will be discussed. Let's take a look at genomic alteration. In 2012, Grasweder started whole exome sequencing on 50 mCRPC patients, which is the first study on gene alteration. Since then, many studies have been conducted and the studies are organized in a table. Taken together, it is thought that PT53, P10, and AR are mainly expressed in advanced prostate cancer. In addition, BRCA2 related to DNA repair pathway, APC related to Wnt pathway, PI3K related to PI3K axis, and BRAF related to MAPK pathway appears as major alterations. Most of the studies were conducted in the USA, and the study conducted in Korea show a slight difference in the incidence rate compared to the previous studies. But it is difficult to draw conclusions due to the small number of subjects. There is a possibility that there may be differences according to race or stage, so it is worthwhile to apply clinically, and it is judged that additional studies are needed. Signal transduction pathways that are mainly affected in prostate cancer include DNA repair pathway, PI3K axis, MAPK pathway, Wnt pathway, cell cycle pathway, and many of them are being studied actively as therapeutic agents because they can be pharmacologically refined in response to molecular target therapy. Of these, the DNA repair pathway has been the most successful. It is a mechanism that interferes with the repair of damaged DNA, and the typical alterations are BRCA1, 2, and ATM. The main treatment is PARP inhibitor, and through two representative studies, olaparib and rucaparib were approved by the FDA last year and this year, respectively. It is expected to be used as a useful treatment for mCRPC patients with DNA repair gene mutations. The second is the PI3K AKT mTOR axis. This is also a pathway that affects many cancers, and the representative alteration is P10. There are several studies using mTOR inhibitors, but it is still unreasonable to expect clinical applications. I think more research is needed. MAPK pathway is also one of the major pathways, and the major alteration is BRAF. However, treatment with BRAF inhibitors is limited to few cases and has clinical limitations. In addition, the Wnt pathway, cell cycle pathway, and the receptor tyrosine kinase are considered potentially actionable genomic signal pathways, but more studies are likely to be needed in the future. Potentially actionable genomic signal pathways and the molecular target agents currently being studied are summarized in a table. PARP inhibitor is now clinically applicable, and its effectiveness is expected to be more clearly demonstrated through many clinical studies in the future. mTOR inhibitors and BRAF inhibitors are thought to have a lot of potential, but more research is needed for clinical application. Further studies on other applicable pathways and agents will need to be conducted in the future. Finally, the status of biomarker development for diagnosis. The development of an ideal biomarker is a very important step in identifying high-risk cancers, detecting cancer progression and recurrence, and predicting the prognosis, thereby effectively enabling the establishment of a suitable treatment strategy. Recent studies in the field of prostate cancer have performed next-generation sequencing, including wide genome association and mutation, non-coding RNA, somatic mutation, chimeric RNA, and gene fusion to develop biomarkers. And through this, several indicators that can be potential biomarkers were suggested. Kannan et al. Analyzed the transcriptomes of 20 cancer tissues and 10 benign tissues and confirmed a potential association between chimeric RNA and prostate cancer. In addition, Plueger et al. Analyzed 25 human prostate cancer tissues and found 7 novel gene bindings, including the TMPRSS2 gene binding, which is present in 50 to 90% of prostate cancer and is known as an early molecular event associated with disease progression. There are several studies conducted in Asia. In China, Ren et al. Analyzed 14 prostate cancer tissues. Although TMPRSS2 binding was observed at a very low frequency, they additionally reported the discovery of CTAGE5, KHD-RBS3, and the USP9Y TTY15 binding. In the corneal analysis, TMPRSS2 binding was observed in 7%, and these results show that the analysis results may conflict among prostate cancer patients of different backgrounds, so more research is needed. As a result of a comparative analysis of prostate cancer and benign tissues, Arcatip et al. Found that transcripts belonging to the gene DDC, HEATR5B, and GABPB1A51 were expressed differently between the two tissues. In addition, when the difference in expression level was further compared, it was found that DDC was remarkably overexpressed in cancer tissues. DDC has been reported to be associated with higher Gleason score and cancer progression with higher overexpression levels. So it can be carefully expected that it can be used as a potential biomarker for prostate cancer through more studies in the future. Here are conclusions and promise. To date, overall treatment for advanced prostate cancer has focused on the androgen pathway. As research on immunity and molecular genetics has achieved tangible results and changed to the cancer treatment paradigm, interest in prostate cancer is also increasing, but it is still in its infancy. Because biomarkers and targeted therapeutics can be developed through a better understanding of the molecular biology of advanced prostate cancer through genomic approach, the interest and research of many prostate cancer clinicians is essential. In the future, I think the time will come when we can provide appropriate counseling according to the individual characteristics of the patient and decide on effective treatment policy.